Good day, everyone. My name is Brian Borda. I'm the Healthy Base Initiative Program Manager in the Office of the Deputy Assistant Secretary of Defense for Military, Community, and Family Policy. Today I'm going to give you a little background on the Healthy Base Initiative and where we currently are. So the Healthy Base Initiative was basically created out of the National Prevention Strategy, and that is the administration's plan for the long-term health and wellness of the United States. And from that, the Department of Defense created something called Operation Live Well, which is the DoD's response to the National Prevention Strategy, which is the DoD's long-term approach to addressing improving health and wellness within the Department of Defense. The Healthy Base Initiative, as you can see on slide 2, focuses on 3 areas: tobacco-free living, active living, and healthy eating. And we basically picked those 3 areas because we thought they most directly impacted readiness and healthcare costs within the DoD. On slide 3, you'll see our objectives. We're basically trying to improve recruitment readiness, resilience, and retention, and lower long-term costs to the DoD, primarily healthcare costs. Focuses on prevention. Slide 4 depicts our locations. We have 14 sites throughout the country and 1 overseas location. Basically what we try to do is pick a diverse range of DoD installations based on the population, based on demographics, based on mission, based on regional location. We also have 2 of our partner organizations. That would be the Defense Logistics Agency and Defense Health Headquarters as well. Our burning platform. So in 1990, there really wasn't much of an obesity problem in the U.S. If you fast forward to 2010, you'll see where about 1/3 of the states are considered obese, another 1/3 are considered overweight, and by 2030, the majority of the country will either be overweight or obese if this model holds true. And that's a national security concern for the U.S. Right now, only about 25% of 18 to 24-year-olds meet the basic minimum fitness and weight standards to join the military. And with these statistics on the rise, we're going to see that percentage go down if the trends continue. Slide 6 is the burning platform for tobacco. And as you can see, about 40% of our enlisted members do use tobacco, and about 40% of that 40%, they begin using tobacco after they join the military. So that's a concern as well. We wanted to talk to you a little bit about how we are measuring the Healthy Base Initiative, and one of the tools we're using to do that is what we call the MNEAT. It stands for Military Nutrition Environmental Assessment Tool. And what this does is it will give you a snapshot of the availability of healthy food, healthier food, on a military installation. We've kind of done it by categories, you can see. So the dining facilities do pretty well, actually. The challenge with the dining facilities is that they're limited in scope, they're limited in who's allowed to use them, they're generally limited in hours of operation, and we have seen many of them close over the years across the DoD. As you can see, fast food, very low, scores very low as you would expect. Commissaries do quite well, although commissaries we don't really consider a traditional meal destination, more of a grocery store type environment. And convenience stores, very low, and then vending is the worst. So as we go through our HBI initiative, what we're trying to do is basically improve these marks here across the HBI installations. In slide 6, these are a little bit of our outcome measures, the overall things that we're looking at: obesity and tobacco use, and these are a reflection of what we're seeing at the HBI installations now. This is baseline data before the HBI initiatives have been measured. What we hope to do is move the needle and see these percentages drop as we go through HBI. So some of our initial observations, we found that the DoD does fitness very well in terms of providing facilities and programs and things like that. We have run across some challenges with access, hours of operation, with people's extended schedules and locations of where they're located. So we're piloting some 24-hour unmanned fitness centers, which are proving to be very popular and working very well. As I said before, dining facilities do provide some healthier options. However, they're limited in operation and authorized personnel, and some have closed, as we've talked about before. Customer satisfaction also remains relatively low. We think the overall food portfolio really requires significant changes in order to provide more healthier options for the installation. So what we're doing is we're working to improve the variety and the availability of healthier food in the food outlets on the HBI locations. We're working closely with the exchanges to see if we can improve the healthiness of the food in those fast food operations, and also to try and see if we can bring in some of the more healthier varieties of fast food chains as well. Health and wellness, we found that readiness can be improved through community-driven strategic plans. Some of the models that we've seen are health promotion councils that address issues corporately for the entire installation. Tobacco is something that we've taken a corporate approach on. It started out just under HBI doing some things, but the Secretary of Defense directed that a Defense Advisory Committee on Tobacco be established to provide him with some recommendations for the entire DoD. There's a little bit on the way ahead. We're currently in the demonstration period. We expect to wrap that period up by next summer. And then after that, we're going to write a report, take a look at the lessons learned, codify the lessons learned through some policy changes. We want to create some resources for commanders that they can implement some of the things that we've learned, and then a communication strategy so we can talk about what we've learned and communicate what we've learned. That's kind of it in a nutshell on HBI. I hope you found this helpful.